The Guillan Barre syndrome. It is an acute autoimmune disorder where there is demyelination in the peripheral nerves. There is symmetrical ascending polyneuropathy that occur after an infection. So it's post-infectious. But the patient is afebrile, but there is areflexia and loss of position sense, the proprioception. So the loss of position sense or proprioception. The pain is present and patient complains at the nerve terminal, and it affects most commonly the lower limb. They are affected more than the eye. There is areflexia, and LEMS is associated with a small cell carcinoma of the lung.